Good afternoon. My name is Maggie Luo, and I'm the Associate Director of Development and Communications at NAMI, New Jersey. Welcome to NAMI NJ's Multicultural Conversations webinar series, proudly sponsored by AmeriGroup. For 20 years, AmeriGroup has been committed to the health of all New Jersey communities. Through strategic partnerships with organizations like NAMI NJ, AmeriGroup is actively addressing social determinants in a conscious effort to minimize health disparities for underserved and minority populations. NAMI New Jersey is committed to serving New Jersey's diverse communities. We represent the interests of all people affected by mental health conditions, regardless of age, gender, race or ethnicity, national origin, religion, disability, language, socioeconomic status, sexual orientation, or gender identity. With these conversations, we aim to bring more awareness on the relationship between mental health and culture. Today's topic is culturally competent mental health services for diverse communities. We are honored to have four distinguished panelists joining us today. Lily Huang, a licensed social worker and the center manager at the Bergen County Wellness Center in Hackensack. Lily has been a peer program leader with NAMI NJ's Chinese American Outreach Program, CAMHUB, for over 6 years. Tiffany Mayers, a licensed clinical social worker and the Central Regional Coordinator of NAMI New Jersey's African American Outreach Program, ACNOW. Anisha Gosine, a licensed clinical social worker. Growing up in both New Delhi and New Jersey, Anisha contributes to NAMI NJ's South Asian Outreach Program, SAMHAJ. And last but not least, Mercedes Rosa, the Director of Community Outreach for a statewide social services agency, and is in touch with our NAMI NJ en Español program. Welcome all. The audience can read our panelists' full bios on our website. And after the main conversation today, we will have a Q&A session responding to questions from the audience. To our panelists, welcome, and we are grateful that you are joining us today for this important conversation. And I truly look forward to learning from you all. Let's start by looking at some data. This is a very important topic. According to the APA Center for Workforce Studies, in 2015, 86% of psychologists in the US workforce were white, 5% were Hispanic, 5% were Asian, 4% were Black or African American, and 1% were multiracial or from other racial ethnic groups. This is less diverse than the US population as a whole, which is 62% white and 38% racial ethnic minority. The good news is that the psychology workforce is becoming more diverse as more racial ethnic minorities enter the workforce, like all of you here have. 32%, which is a third of psychology doctorates earned in 2016 were awarded to racial ethnic minorities. Now, as members of racial ethnic minorities ourselves, we all work with individuals and family members in our communities in different capacities. I wanted to go around the Zoom room and hear from each one of you regarding your personal experience and what you have observed. Let's start with you, Lily. Lily, as a peer program leader, can you describe your experience in seeking mental health care as an Asian American growing up in New Jersey? And specifically, if your family was involved when you first sought treatment, and was mental health spoken about in your household?
Oops, now, okay. Hi. So yes, I grew up here in New Jersey, and I was actually an adult by the time I started to seek mental health treatment. I was in my 30s, and I have had several therapists over the years. I've actually never had an Asian therapist. I've had almost everything. I had white, Jewish, Black. So I have had a variety of experiences in therapy. And I've actually always wanted to find a therapist that had a more similar background to me. So it's a little bit problematic because, as you just said, there aren't that many in the field. I think you said 5% of people working in the field are Asian. So you don't really have a lot to choose from. And then I think a lot of the ones who are, they might be immigrants. And so I have a very specific, upbringing that is not, percentage-wise that common. So it's a little bit hard for me to find similar people around here. And, so that's been my experience. I actually sought out mental health treatment completely on my own. Growing up, we didn't talk about mental health or even really know what that was. I think that there's just a completely different system of emotions in Asian culture that, it's just not the same at all, just not really the same awareness of what's going on. And so I actually had to learn all of that on my own. I didn't tell my parents when I went. I just kind of went. I think that they knew that I was doing things because sometimes I would sign up for, a mailing list. And so I would get something in the mail, like pamphlets. So I think that they did know, but they didn't really understand what was happening or what I was really doing. So that's been my experience.
Thank you, Lily. And it seems that you're very proactive in seeking not only treatments, but related resources in the community, right? And we heard loud and clear that you would prefer someone from your same culture, but it was just not as available. Thank you for sharing that, Lily. Tiffany, I know that you are a caregiver, right? Can you describe your experience advocating for your loved one and yourselves in the current mental health system?
Sure. First, I just would like to thank NAMI New Jersey for hosting this much necessary conversation. So thank you, Maggie, for that. And as Maggie explained in my short bio, I am a mental health clinician, but I am also a caregiver to a child diagnosed with ADHD. So at the time of us moving forward with that, we had to learn how to navigate the system. At the time, my brother was school age. Very young, maybe about 8 or so. So we had a lot that was thrown upon us at one time. So of course, because we weren't very familiar with the diagnosis that that was given, and with the amount of stigma that sometimes is in the African-American community around mental health. And I'm sure we'll get into that conversation a little more later on. But it was really hard to kind of get my mom to understand exactly what was going on and how we were going to be able to help my brother, which is what led me to NAMI New Jersey. So thank you for all the help, NAMI. But as far as advocating for my brother, we just had to be informed. We had to do our own due diligence to make sure that we were informed of the services that he needed to receive. We became very educated on the school system and its services that he could receive, as far as like individualized education plans, IEPs that most students have with diagnosis of ADHD. And I think some of the experience were challenging. Sometimes my mom felt intimidated by the amount of information she was being given. Sometimes she felt like people were speaking over her head, but we were a partnership. So together, the two of us just really made sure that we were as informed as we could possibly be. So that way we could be a united front to help my brother receive the services that he needed, especially because he was so young. And then we just made sure that we stayed on top of his insurance company to find out different services that his insurance would allow for. So I think the most important thing that any caregiver could really take away from this conversation is to be informed, not to be intimidated, and also to really do your own due diligence to know more about the diagnosis, as well as how to best help your loved one, whichever, even if it's an adult or a child, how to best help them.
Thank you, Tiffany. And just now you mentioned a few points where really touch upon the fact that family members are usually when they were helping their loved ones, would usually be encountering some of the barriers. Could you talk a little bit more about what type of typical issues do caregivers often face?
Oh, sure. So in our instance, there were things like lack of accessibility to services. My mom particularly wanted my brother to work with an African-American male. So as you mentioned, the numbers are very low for African-Americans, and particularly males even more beyond that in the field of social services. So that was a barrier. Sometimes the location. We grew up in an inner city area, so my mom didn't really drive much. So being able to physically get to the services for my mom and my brother was a challenge often. Outside of that, sometimes it can be insurance and the different services that certain insurances do not, certain clinicians do not accept certain types of insurances. And so those were probably the key barriers that we faced. I think in general, for us, the African-American clinician was probably the largest hurdle that we experience, but because of my savviness in the field and working with my mom and other agencies like NAMI New Jersey, we were able to really find someone that fit the criteria that we were looking for. But that's not to say that it did not come with delay in service and also with a great level of difficulty. And if things needed to change, or we may have needed to extend services, maybe that person was no longer available. So definitely trying to find, and similar to what Lily said, trying to find someone that meets your needs was and is often a barrier, even for clients that I currently work for professionally as well.
Thank you. Excellent points, Tiffany. And those are truly highlighting the importance of our topic today.
Absolutely.
Anisha, I want to turn to you. I know that you are a caregiver, a sibling, and a provider from previous conversation, right? We want to learn from you. How do you use your personal experience as a support system to improve cultural competence with your services? Can you share a little bit?
Sure. So just a little background. My sister is the one who propelled me to get into the mental health field. She is 20 years older than me. So seeing her grow up, well, I was growing up with her, but seeing my mom navigate the system was very difficult for her. Not only the stigma, as Lily and Tiffany both mentioned, but also the lack of services within South Asian community till we came upon NAMI Samaj. And that is how, she began to flourish and talk more about her dilemmas with the mental health field and her diagnosis and the stigma that comes with a diagnosis. I think for me, what I learned is to observe her and to help her as a support system to really open up the avenue of her being able to communicate her needs. I think often the issue is communication and the inability to feel comfortable in talking about whatever you're going through. So as her sibling, and then later on a provider and a caregiver, to a certain extent, I learned from her to be able to emulate what I wanted her to be able to bring out in her ability to talk more and be comfortable, and helping my mother navigate the system. So I think with my own clients or as a provider, what I try to do is be informed as much as I can about the cultural backgrounds, the inter and intra-cultural backgrounds of everybody that I serve. Obviously, it's not, foolproof, but to do as much research as I can to understand linguistics, body language, with nonverbal cues, which are huge, and just to know, before I even meet a client, what I'm running into, so I can understand them a little bit better.
Interesting. Thank you, Anisha. Now, just now you mentioned that you are a sibling who was, who is younger, much younger than your sister. So you're not a direct caregiver, hasn't been, right? But can you talk a little bit about how different you see being a support system versus being a direct caregiver?
Sure. So, oh, I'm sorry, I didn't mean to cut you off. I think the biggest difference for me is I'm not as a direct caregiver. Exactly what the term means is I'm not directly involved in having to, manage her care necessarily. My mom had to do more of that. As I grew up, I've taken on more responsibilities of that as my mom is aging herself. But I think as a support system, I had a backseat to observe and be able to be an unbiased support system, because as a caregiver, you don't mean to be biased, but you're involved. You're very much fully involved in being able to having to take care of whether it's medication management, whether it's them getting their services that they need, them articulating their needs, so you're much more involved. So I think as a support system, I was able to help triangulate the support from my mom and my sister, being like a mediator, if you will, to help them kind of come together, and so that she could get the services she needed, but my mother could understand what mental health is about, because I was lucky, or my sister's fortunate to have my mom who was willing to understand despite the stigma in the South Asian community with mental health. And so I think for me, the biggest thing as a support system is that I have a backseat and I'm able to kind of navigate and help them kind of see eye to eye.
Thank you for that, Anisha, because it seems like both you and your mom as a direct caregiver for herself, right? You seem to have different roles and unique roles in supporting your sister. But then it seems as a support system, like you said, you have more leverage in terms of building relationship and listening and really be complementing what your mom could support your sister.
Absolutely.
That's great. Thank you, Anisha.
You're welcome.
Mercedes, you are really representing the provider perspective today. Okay, even though all of us are here, we in some sense we do want to speak to that role. But as a provider, how do you think a person living with mental illness can advocate for themselves, especially those in a racial and ethnic minority group?
First, I want to say I come with many lenses to this work. I am a granddaughter. My maternal grandmother has schizophrenia. I am a mother of 2 children on the spectrum. And I also have a brother with schizophrenia and a sister with bipolar. Through my work, I get to support self-determination and self-advocacy. So I want to preface to say that, cultural norms within families sometimes block access to care, how families perceive mental illness like every other illness. Sometimes there's that awareness, lack of awareness and lack of education that enables families to really come to the table with providers and be receptive to the supports that we're trying to share with them. So one of the supports I usually share with families is really health begins with your primary care, that medical home framework, person-centered care, person-centered planning within the medical home context, and specialists coming together to empower families with that information and advocacy to understand that mental illness, like all other illness, is treatable, is manageable with supports, with information, following routines and care, and navigating educational systems, service systems, connecting with providers. So through self-advocacy and with the young adults I'm privileged to work with, we support them with information about their diagnosis so that they are aware of how to manage their care, what's going on with their mental health, and what will enable them to live a fully integrated life and to self-regulate and get the supports and tools and strategies they need to succeed, and to see opportunities to reflect and connect with the best supports that enable them to be their best selves. So having said that, access to health is sometimes a barrier, as Tiffany shared, barriers with insurance, barriers with finding providers that are receptive, but sometimes families are a barrier. to that care. Sometimes faith is a barrier, and faith is weaponized, and they're encouraged not to seek out help. So being empowering self-advocates through information within their medical home, starting the conversation, and giving families the tools that they need to understand mental health is part of health. Accessing treatment and care is pivotal to ensure that their young adults or that their young children will receive the tools, the empowerment, access to education, all of the different things Tiffany shared about the educational plan, all of that across systems. Families really come to the table. Initially, they represent the young adult or the child. So it's very important to equip families with the awareness that they need. And sometimes culture and different dynamics are a barrier to that. So I say the medical home framework, person-centered planning is really, really key in finding specialists that will take the time. There's also opportunities through your HMO to receive health education and becoming aware, like with other conditions, if we have asthma, we get that instructional support to know how to manage our care. So I encourage families to take advantage, and providers, I've had the opportunity to work on both sides, empowering providers to become more responsive to diverse cultures. So I come through the lens as a friend today. I want everyone to know I come in peace. And I really believe that as we work together, we really will create outcomes that are more impactful and positive for all families.
Wonderful. Thank you, Mercedes, for those points. And I know that it's very interesting that you mentioned about educating not only the family members themselves or the individuals, but also it's a two-way process where the family members and the individuals can actually educate the providers in what their experiences are and how they want to be treated. So that's very important. Thank you, Mercedes. And just now you also mentioned some barriers, right, that you have observed. One of them is the language barriers. I wanted to ask, how can the person advocate for themselves if there are language barriers, and how can they let their families advocate for them if their family also does not speak the language?
So that is a really great question, and there's some providers and some hospitals that do a really good job. Because I primarily have worked with the underserved community, I'm a firm champion for the federally qualified healthcare centers because they do have a diverse representation of the community. Their services provide, their staffing reflect the community. So that's one thing I want to encourage the providers who are on today. Another way, if the individual has barriers, they can advocate for language access. Actually, they have the right to language access. They're protected by Title VI, and they're protected by Executive Order 13166 to advocate to have access to language. And that's resources that are written, that's websites, that's reports, that's all of the things that are going to ensure that they have meaningful engagement with all providers. So it is something that sometimes is not done, but they should come to the table from a place of informed advocacy, a place of strength. They're not asking anything that is not required. And all of those providers that receive federal dollars, Medicaid dollars to deliver their system programs, they're required to provide meaningful access to, especially around healthcare. Major decisions are made around healthcare, and it's life and death sometimes if you don't understand what's being communicated and part of your treatment plan. So advocacy is key, and going up the chain of command. If you're not seeing that there's a response, you can you can file appeals and follow that process of legal access to ensure your outcomes are achieved.
Thank you, Mercedes. And those are wonderful empowerment resources that families could utilize to really advocate for not only educational, but also other language access resources. One word about the resources that Mercedes and the rest of the panelists mentioned. We are going to post these resources online after this webinar. So feel free to come back to our website for those, like Title VI and the executive orders. Those will be posted there. Okay. Now, Lily, and also the rest of the panel can chime in for this question. We sometimes hear from individuals of lived experience in our support groups that they would actually prefer seeking therapy from a provider from a different cultural background from theirs. So from your work among peers, what do you think could contribute to that perception or preference?
Well, my preference, as I stated earlier, I think actually it would be good to have somebody who has a similar cultural background to you. I've participated in the CAMHOP, which is a cultural support group. It's Chinese American mental health support group. And I do think that there's a difference when you have a group of people who have that similar experience, because you can just refer to some of those experiences a little bit more easily than you would to somebody who just doesn't really have to deal with that. Especially, for example, with recent news events, there's a lot of things that you experience as an Asian person. And when you see it in the news, that's just the biggest instance of it. But you experience small instances in your own life all the time where you may feel like somebody's just treating you a certain way. And that's something that I just leave out when I talk to other, somebody who's doesn't have that, or I just don't talk about it. But it is a factor in your life, like how people look at you and what they expect out of you when they see you. I think that race is a huge part of that. And I personally don't think I always fit how people want to relate to me. And so that may cause some problems, but I just have to deal with that by myself, and sometimes with the peers in the group. So I do think personally that having somebody with those similar experiences is a good thing, and I'm not sure why people wouldn't want to have that.
Thank you, Lily. And how about the rest of the panel? Anyone would like to chime in for this question? Tiffany?
Jump in, because I think that my circumstances were similar to Lily's in one instance, but different on the other side. So as a caregiver, as I mentioned earlier, I think it was important for my mom and I to find a clinician that was of the same background as we are, African American, and particularly a male for my brother, because at the time, with many of the challenges that he was facing without that male, I don't like to say role model, but that male presence, so to speak, within the home, we wanted to make sure that he was able to receive those services. So through the Perform Care services that he received in home, he had a clinician, and he also had a male mentor, a behavioral assistant as well, who would take him out into the community. And they spoke with him directly about being a young Black male. And that was necessary at that time. For myself, from a personal perspective, when I initially sought therapy services for myself, it was because I was having a challenge at work with a female African-American supervisor. So I deliberately did not want to work with an African-American female, because at the time I knew I would not be able to separate the challenges I was having with what my therapist sitting across from me, who would resemble the supervisor for me. And so I knew at that point I could not. So I deliberately sought out someone who did not fit the criteria of aligning with my cultural and racial background. But I definitely agree with you, Lily. I see the importance of it when the need is there, and depending on what your circumstances are, I could see that it could present great strengths so someone can understand you a little bit more, obviously without overestimating that just because someone is within the same cultural background, that their circumstances or their upbringing is going to be very similar to yours. I get that a lot as a clinician, and I'm always like, oh, I hope I'm living up to their standards at this point. But I do see the value in it, as you said, Lily. But I just wanted to mention the other side of the coin for when it might not be best to be paired with someone of your exact racial and ethnic background.
Thank you, Tiffany. And I see that Anisha wanted to chime in as well.
I did. I want to piggyback off of Tiffany and Lily. I see both sides as a provider and a caregiver / support system. My sister obviously was seeking services 20 years ago, much different field as far as the percentage of South Asian clinicians back then. There were none, since there are only 5% right now of Asians altogether. So I think for her, she needed that. The need was there, and she couldn't find any clinician who was able to understand her cultural background that she was seeking care from, which was very difficult and disheartening for her, because then she just stopped seeing clinicians altogether. I think this, and I don't think clinicians necessarily were trying to minimize her needs. It's just sometimes when you don't have that cultural competency, people, it just kind of creates a barrier of unspoken, perhaps. So I do think that it's important for people to seek what Tiffany said, and I agree with Lily on, depending on the circumstances, some people might want to veer towards a clinician, a provider who is the same background, but also understanding you can be the same background and be an immigrant, be a first generation, second generation. Like I was born in India, but I've been raised in New Jersey and in India. So I luckily have the beautiful experience of having lived here and there. So I know the cultural dynamics in India and also as an American South Asian. So I agree with both Tiffany and Lily that it really is dependent on your need as a client.
So I just want to add that, not all the time will there be that diverse provider, but from the immigrant Latino perspective, they've really adapted and sometimes do not want another Latino provider. There's a lot of assumptions and a lot of biases that come in treatment when they feel like they know you or they can culturally connect. And sometimes they're not open to hear your truth, hear your story, hear what you're trying to say. And they come with prescribed, knowledge. So I think it's important for just providers to understand that as long as there's a staff or a team member or clinicians that have cultural humility, they're willing to walk and learn about cultural awareness and ask to learn, develop cultural skills and cultural responsiveness. I think families and young adults are really open to those that hear them, see them, treat them with that respect, and are willing to come to the table without assumptions, preconceived notions, to meet them where they're at. I think that's a vital component, because we can't always have the cultural representation that we seek, but we are willing to meet those at the table that are willing to support us where we're at.
Excellent discussions. Thank you so much, all of us. We do see different angles and challenges in this, but hopefully with more and more discussions on this, we are going to play a part in improving the mental health care system as a whole. I wanted to come back to one of the points that Tiffany raised. Really, it's about stigma. Stigma is across the board, but for today's conversation, I wanted to focus a little bit about the stigma within the mental health service setting. So as a caregiver in African American community, Tiffany, do you feel stereotyped or misinterpreted when advocating for your loved one, your sibling, in the therapeutic setting or the service setting? And the rest of the panelists can chime in afterward too.
Thank you, Maggie. So I will say at the beginning of our mental health journey with finding services for my brother and trying to navigate the education school system, I don't know if it was that we were misinterpreted, but I definitely feel like there were meetings and there were instances where it felt like we were deliberately trying to be almost spoken to in a condescending manner. And again, this might have been about 12 or so years ago from today. But at the time, I had not completely finished my education in psychology and social work. So I wasn't as informed as I am obviously today for the services. So as I was still learning things, when I would hear stuff in a meeting, I would say, but that doesn't sound right. I know that there was something else that we should be able to do. We can't just only have one session and that's it. Like there's got to be more. And I think that that's really what led me down the path to finding an agency like NAMI New Jersey, because we really needed support at that point. And in the Black community, or at least within my Black community, because I won't speak for the Black community as a whole, but within my Black community, mental health was still very taboo. And it wasn't something that my family members were willingly speaking about. My mom was, I'll say slightly, in denial about what was going on with my brother. But because I had a level of education, I understood. But what I found very grateful of receiving from NAMI New Jersey was the Act Now multicultural program. And once I went to that first conference, I said, I must devote my time to this organization. And I since became a volunteer. And now I go out into the community, particularly in the Black community, and I do different talks and educate the Black community on mental health and the different services that are out there. So I would say it was less that we were misinterpreted, but definitely felt like we were at a disadvantage at the beginning. Once we became more equipped and more educated, then we were spot on. Like, well, no, I know you're supposed to do an IEP re-eval every 6 months, and we're supposed to get the printout once a year. We then became real advocates for the system and for my brother in the system. And then to other people within our Black community that we knew children had similar circumstances, but they were just as lost as we were at the beginning. So it was kind of, we learned and we passed that information on to somebody.
Thank you, Tiffany. And thank you for really being an amazing advocate through the years with Act Now and beyond. Truly an ambassador for the cause. Thank you, Tiffany.
Thank you, I appreciate that.
And wonder if the rest of the panel would like to add anything regarding stigma in the service setting.
Sure, could I chime in there? I think piggybacking off of everything Tiffany said, I think that advocacy and awareness is key. So I think in my personal experience and my mom's personal experience, the stigma in the South Asian and many communities, but speaking from personal experience, the South Asian community is still taboo. And a lot of times it's family that unfortunately discourages seeking out treatment due to whatever have you, whether it's faith or personal deterrence, because you don't want the community to speak. That's a huge thing, is like, what will people think? What will people say if they find out? So I think stigma plays a huge role in people not seeking services, whether it's stigma that they feel personally that will befall on them, or because others will, stigmatize them. I think that's huge in all communities, but especially within our community. If my mother hadn't been such an advocate for my sister, I'm not sure she would have even sought out Samaj through NAMI, or, just the services she currently has. I don't think would have been able to be done if it wasn't for one person who was shining the light. And then, I hopped on the bandwagon once I got my own education, and I learned and I researched a lot on South Asian culture and diversity and, on mental health services. That's how I was able to help my sister navigate the system once I became knowledge to myself. But stigma is very much still prominent. It's just, luckily, I hope, and we have been talking more about it, I think, which helps that, get less and less, hopefully, with time.
Thank you. Truly, that's the hopeful message there. I remember when we were chatting on the team meetings, at NAMI New Jersey, we're saying that we're really working hard to fight for the day when we are not needed anymore, at least the advocacy arm of it, right? So thank you, all of you, for being amazing advocates. I'm sorry. Okay. So I wanted to ask Anisha. We know that you're a caregiver, a support system, and a provider. What would you think is an ideal balance to assist those who are trying to receive treatment, but also wanting to be understood from their cultural background? How could providers enhance or work on their cultural competence?
Sure. I think a big part is really putting yourself in their shoes in the sense of like doing some research and some background knowledge on what cultural competency means, first of all, and then what, cultures, ethnicities, biodiversity, multiculturalism, what all that really means, and just kind of doing your own research. That's how I started off when I started in school. They weren't really, I did take a cultural competency class, but that's just one class for, one semester. I took it upon myself to ask questions, my friends from different backgrounds, what's acceptable, what's not acceptable. Eye contact, for example, in a lot of cultures, to make direct eye contact is looked at as impolite, while, as Americans, you do make eye contact. That's impolite to not make eye contact, you feel dismissed. So I think that's a big one for me. Nonverbal cues are huge in the therapeutic world, to learn, how to talk to somebody, the different nouns or pronouns, how you refer to somebody, like I've noticed in the South Asian culture, they don't like it typically, I'm generalizing here from my experience, to say their name. They would prefer Mrs. So-and-so or Mr. So-and-so until you get comfortable and you build a rapport, then perhaps you can navigate the, different names. But I think a big part is just doing your research, asking them as, clients, what they need, what their needs are, what their barriers are, what their boundary setting is. I think boundary setting is huge in understanding what a consumer or peer or client would need from a clinician or provider. So just asking, being curious and aware, and advocating for them by asking them self-determination, I think gives them the empowerment to be able to speak up through you helping them feel comfortable.
Wonderful. And I wonder if the rest of the panelists would have anything to add to this on the level of just the provider level. How could providers enhance their own cultural competence?
I would say that, consider everything about your experience that you're providing to members of the community from the time they enter your space, enter your building. What does it say about the type of services that you provide? And that includes pictures on the wall, staff having language access to ensure that they're going to be able to navigate and achieve a successful visit or a successful encounter with your agency. So do you have a warm and welcoming staff? Are you mindful of the resources that you lay around at the table? Are they reflective of the diverse communities that you serve? If you have pamphlets around, are they representing just one culture? So it lets consumers know that you've thought about them before they've walked into your office. You created a welcoming aspect, even though it's nonverbal in nature, but it sends a signal that you're ready to have an encounter with them. You're ready to serve them. You're ready to answer them. You've thought about some of the questions or some of the needs they might have. Also meeting with cultural brokers and people in the community to help you inform policy and practice. They'll let you know where your gaps are, where your blinders are. Sometimes we develop a lot of great ideas and procedures and protocols, but they haven't been really checked with the community, which are the intended beneficiaries of our services. So I think welcoming the community, having focus group and dialogue with them to allow them to evaluate what you're doing well, and what you could be doing better.
Thank you so much. And I remember at one of the meetings, because NAMI New Jersey sits on the division's Multicultural Services Advisory Committee. And one of those amazing, wonderful meetings, we did talk about, how the setting, that we can really make a difference starting from the first minute that the clients come in. So Mercedes, just now you talk a little bit about that micro level, right? So as we know, cultural competence and humility has been one of the training focuses for mental health service workforce. But on the macro level, how do you think that the mental health system can be accountable and ensure that the best services are provided to the client?
Well, I definitely think now services are changing. COVID has changed the landscape of how we can deliver services. I've often heard from families and self-advocates that the systems are somewhat broken. So now that we are navigating a pandemic and we're learning to do things differently, it's a good time to reevaluate our service delivery models to see where we have been falling short and engage in conversations with, again, the consumers and the intended beneficiaries to see how we might continue with some of the good things that we've put into practice through the pandemic, but continue to achieve increased responsiveness and increased humility through practice, through action, through learning, inviting family members, those with lived experience, those that are living with mental health and mental disease to be part of your advisory, to share with you what might improve your practice and make their encounters with your organization more meaningful and just more responsive to who they are as individuals. Our best promotion is a successful encounter. They're going to recommend your services. They're going to say, wow, they really helped me. So I think achieving a successful encounter with a member of the community is kind of like the woman at the well experience. They're going to go back to their community and they're going to tell everybody that they found water, that they found a responsive practice that addressed all of their intricate needs. So I think self-evaluation, doing the self-assessments and having an outsider assess where you're at in practice and protocol and procedure to improve your overall service delivery model.
Wonderful. Thank you so much, Mercedes. And I wonder if other panelists have anything adding to this question regarding the macro level, the system, what you have observed, and any messages on that.
So I, from a professional perspective, I do a lot of work on a macro level because I'm very interested and passionate about being able, one, to be able to provide that direct care, but also to be able to reach a broader scope of people. So I think when you're talking macro, similar to what you were just saying, Mercedes, it's really about the evaluation of services that are being provided and how can you replicate the things that you have been told through feedback and surveys that have been beneficial for your agency or other agencies, and then how can you improve the feedback of areas that maybe have been weaknesses for you. So I think particularly when working within the African American community, I think it's very important to understand the nuances of what that means. This kind of goes back to what Anisha said earlier about knowing that there's different dialects, there's different subsections and that type of thing. But I think once you are able to be knowledgeable of that, then you'll be able to provide those services as a provider on a better culturally competent scale of work that's needed within these communities. Because anyone that's on this panel today, we are similar in the sense of we're all seeking something, but I want it to be sought out in the way that works with me as a unique person. And it's important for us to remember as providers and even as family members that you have something that you're trying to attain. It's just like a medical doctor appointment. If you go to the medical doctor and you don't feel like you're gelling with that person, you don't feel like you're getting the services that you really need for whatever your condition is, then you have the right to seek out services somewhere else. So I think from a provider perspective, we have to keep that in the back of our minds as well, that we have a service to provide. And if we don't provide it at a level of excellence or a level of culturally competent, then the onus is on us to do that, to be informed, educated, stay abreast of any changes that are taking place. You know, different communities, there are verbiage that may shift over time. We need to be involved in that education to be able to provide those services. So I think that a lot of that takes place on that macro level, as far as like the bigger picture of it, and then it kind of trickles down to how you provide the services on a one-on-one level with your clients.
Thank you so much. That's very meaningful conversations there on that point. Okay, so I think that we are going to transition into the Q&A session because we have a few minutes left and we do have very good questions here. The first one, I'm looking at my screen here. With the percentages in terms of 4% Black clinicians, does that mean in New Jersey or nationally? To that question, the number 4% is national number in 2015, but since then the number has risen. And then in New Jersey, I do not have the specific number. If any panelists have, please share. And I'm going to.
I'm trying to see if I can locate it for you, Maggie.
Thank you, Tiffany. And as you are looking for that, I saw a question here. I'm going by the time sequence. For people of color and immigrant backgrounds, people's level of assimilation and acculturation falls on the spectrum. That's very true. Do you think if an individual is less identified with their cultural background, then the cultural background of the provider is less important? What if you don't gel with or bond with a provider of your own background? Should you look elsewhere to find a better fit? If any panelists would like to take that question.
I would love to answer this question. I think that any provider, first of all, usually starts off sessions after an intake saying that if they are not fulfilling your needs, of course, giving a provider the chance, that they should communicate, the client should communicate that to the provider. Essentially, not every shoe fits, not everyone is going to be for everyone. And so I at least make sure that my client is aware that they have that chance, whether they're my background, South Asian or not South Asian, to be able to let me know that, listen, this is what's working, this is what's not working. And I try after, every 3 sessions or so to ask about progress. If they see we are moving forward, with the treatment plan, of course, but also just with the rapport. So I think to answer that question, it's absolutely okay, even if you're from the same cultural background and you're not vibing or gelling, that you have that opportunity to tell that provider. Essentially, then you're just not utilizing your time or their time, well, because, then you're just having sessions to have sessions, which isn't going to help you if you don't feel comfortable speaking your truth.
Thank you, Anisha. Okay, we'll go to the next question.
Oh, wait, could I say a
Lily.
response to that? That question reminds me of the first therapist that I had for a long term, and I remember she used to tell me, because I had moved back in with my parents, and so she was in the next town from me, so she was familiar with the area. And a couple of times I actually did try to, I remember this was years ago, but I did try to bring up with her some of the things about my experience, growing up in that area, being an Asian person, and it really didn't work out. She would kind of dismiss what I was saying and say, oh, you grew up here. So, and it's funny because my parents actually said some of the same things to me, like, you don't have a problem because you grew up here and you know what it's like. But I actually did have a lot of issues with, just growing up without a lot of people who were similar to me. And I think that definitely is a huge part of my experience and how I am. And, what's funny is like some people think that you're assimilated because you grew up here, and you kind of are, but then like I'm very cultural. Even though I grew up here, I was raised by my parents. And so that shaped how I relate to people, how I instinctively want people to relate to me. And I have to do a lot of things kind of in manual, because automatic is not going to work. And so I actually, when I was in college, found a book, and it was an earlier version of the book that I put in the references, because we were asked to submit some references. And there's cultural psychology, and there's something called collectivist and individualist cultures that you don't hear about when you go to a master's in social work program or anything like that. But when I found out about certain concepts like that, and I found out about that on my own, it really clarified for me the difference in cultures between Taiwan, where my parents are from, and the American culture. It's very different in certain ways. So collectivist versus individualist is a big one. And then also I think power, like how people think about power and relate to each other, that's another big difference that I experience. So like I said, I believe I mentioned it in my reference. So that's something that changed my life when I was 19, when I found out about that.
Thank you so much, Lily, for that personal experience that you share. Truly adds to the conversation. Okay, the next question. In my experience as someone with schizoaffective disorder, I found over the years that there is a lot of stigma in this country, but there is evidence in recent years that this is changing. What is the stigma level like in places like Asian countries or other countries? Is it better, worse, or about equal? Is stigma towards the mentally ill universal and commonplace in all countries? And anyone want to speak to that?
I can speak to South Asian. I'm from New Delhi, which is the capital in India. I grew up half here, half there. So I would say that from my personal experience, the stigma is very much prominent there. Luckily, I do have friends who still live there who are, raising their awareness of becoming psychologists or social workers. But even the term social work in at least India is more so a form of fundraising or a form of working at a nonprofit if you have extra time after your normal job, or if you're a housewife, for example. And I'm generalizing very much so, but that is the stigma within social work / mental health and psychology. There's just a overall sense of you're either magnifying normal day-to-day problems that people have, or you're crazy. Unfortunately, those type of terms are still used. There's still mental asylums back in, in India, where people are just put there, they're not given treatment. Also, your socioeconomic background matters. The stigma, I think, hopefully lessens when you're aware. Unfortunately, education is not always what helps stigma decrease, because I know plenty of educated Indians, South Asians, who unfortunately are still very afraid. I think fear controls a lot of the stigma in opening up about mental health. So as far as South Asia, specifically India, is concerned, it is better, but the stigma is very much still prominent.
Thank you, Anisha, for sharing that. The next good question. I do want to be cognizant of the time and wanted to go through all the questions. The next good question. Sometimes different communities of people of color can feel estranged from each other. As an Asian American woman, I feel that sometimes I see misunderstanding between people in my community and other people of color. How do you feel that people of color can unite and encourage advocacy between different cultures and races despite various barriers? How can people celebrate their own cultures, but also be open to interact and support those of others? Very good question. Anyone want to take that?
Yeah, I think that's a great point. You know, I think that when you talk about culture, it's not you know, just your appearance. It's some of the dimensions that I mentioned a couple minutes ago. There's actually a lot of similarities between people of cultural backgrounds, and obviously there's differences as well. But it does make me sad when I see racism among people of color, because you know, you're the ones that are supposed to understand that. And you know, I see racism in the Asian culture too. Sometimes it almost seems like, you know, they want to avoid their own culture sometimes, and I'm not personally like that. I don't know why, but I do see that. And it's sad, and I think that we should try to promote people of cultural backgrounds understanding themselves, first of all, so that they can have more of an alliance with other people who they could identify with, and then other people who have different cultural experiences, and yet there's still a lot of similarities that you can relate to.
I think when I look at younger people, I have a lot of hope because they're very positive about their cultural differences, and they celebrate somewhat their diversity. I know other generations, we have you know, maybe a history of historic trauma that kind of, when you think of the iceberg, all the things that happened in the past and are yet unresolved, and things that have been undiscussed or at least validated, sometimes hinder our capacity to bridge the divide in a meaningful way. So I think conversations like this and continuing the dialogue to address the hurt, the trauma, and to heal collectively as communities, because what shapes culture? Politics shapes culture, experiences, discrimination, socioeconomic you know, status and patterns, things that we still have not been able to overcome. And you know, the systemic racism and the social constructs that sometimes keep certain cultures down, those are not things that are imagined. Those are things that we really see in our communities, schools that are you know, not up to par, books. So all of these things are sometimes dismissed when you have certain interactions with individuals of another culture, that and then that's perceived privilege. So there's a whole lot that goes into ways that we can move the conversation forward. But I think having conversations, acknowledging our truth and where we're at, and bringing together our communities and our communities of faith, our faith leaders, our gatekeepers, and we're more the same than we are different. Younger people are kind of embracing even gender and different things where, you know, past cultures may have, you know, a problem with it. So I think we can learn a lot from our younger generations, and believe that they are the future, but continuing the dialogue to learn more about each other and helping one another heal.
Wonderful. Thank you so much, both Lily and Mercedes. You know, this responses to this very good question really touched my heart, you know, because right now there's so many conversations going on, and we do want to be on this journey in a positive direction. And I see a lot of hope as well. Thank you. The next question. Thank you for this panel. I work in community outreach for a domestic violence organization where we provide free services for local survivors. We generally don't post photos or names of our staff online for safety purposes. Besides making sure that our online materials, brochures, and websites are addressing many different communities, is there anything else anyone would recommend that we do to make people from diverse communities feel more comfortable to reach out? Mercedes, would you like to take that question?
Absolutely. I think there's power in stories, because stories, you know, patient stories don't happen in a vacuum, and there's something powerful about a story. So I think, you know, you don't have to disclose who it happened to, but stories of survivors, go a long way to empower other individuals that are seeking, to escape or to leave or to see hope. So I think there's power in stories, or maybe, videos that don't show the faces, but there's also, for those auditory learners, really power in listening that reinforces just that there's another option, another way out. So ways to sow hope would be sharing your member stories or your client stories in ways that reach the community, and express, not who they are, identifying who they are, their culture, that they're diverse. I think all of that goes a long way.
Thank you, Mercedes. Wonderful. The next question. I'm a school psychologist. If we feel a student needs to be classified, parents will sometimes say that they will pay for their child. I see this often with Haitian families. Do you have a positive response? Even if their child is failing, the families do not want the stigma of special education.
I'll jump in for that question. So we hear that a lot, like through Act Now. And I think that that's part of the reason why we've tailored our own outreach to different areas. So we often go to the churches to speak with people regarding mental health. And I know one of my regional colleagues, Donna Williams, often says, like, you can have Jesus and a therapist and those types of things. But I think in a school setting, you may not be able to say that, what Donna says, but I think it would be important to just emphasize the fact that you're trying to provide an additional resource. You're not trying to take a resource away. And that's what I really enjoyed about the Perform Care service that my brother received, but it was a wraparound system. That was the model that they were using, the wraparound model. And from there, it was to highlight the supports. So it wasn't just to say that there was only one support. So I think it's maybe the suggestion could be for the school psychologists to emphasize that there are multiple levels of support for the child. So it can be their faith, because faith is very important to us. It's very important to families. But I think, there's also work that needs to be done, and that's with the clinician. And then also I think schools, and I believe that they've been doing a better job since my brother was in school, but schools have to do a good job at removing the stigma within their own system as well. As far as when I started off, it was called like a resource room, that was called different things. And I know that this question spoke to the stigma of special education. So maybe special education has that negative connotation. So maybe the school psychologist can describe it to the parent as these are just additional resources that's going to be put in place to strengthen the needs for your child. And more so try to downplay the stigma, that because you don't want to seem like you're just perpetuating the stigma yourself. Oh, we're going to pull them out of mainstream and we're going to put them in special ed. Like, that's the lingo sometimes. So I think it's important to say it in a different way, because we've identified that your child is in need of additional services. We have this great opportunity for them to be able to receive these additional services so that he or she are able to receive the services that they need in conjunction with the work of the family and the support from your faith-based community, et cetera, et cetera. So it's not to make one seem like it's higher than the other, but when at school, this is what we have to provide. When at home with you, you can, of course, utilize the resources and the support systems that you have as well. So make it more wraparound sounding. And I think that parents would appreciate that. That is what helped my mom get more on board with it all, because she too was like, well, I don't want this and I don't want that, and was very rigid. I think Mercedes, you had mentioned this earlier, sometimes even the parents can be rigid and can cause their own barriers. So I think, but it's in the communication and the way you speak. And I think that's the uniqueness about being a part of a multicultural program, that you and that education that we've all talked about is really important. So you know how to approach a specific type of family that you're working with.
if I can piggyback very, very quickly, only because my son is also a psychologist, and we have the Planning for Adult Life project through the ARC, listening to self-advocates and seeing those that have that lived experience talk about their journey in special education and how it empowered them. So listening to self-advocates could really go a long way to help families turn the hurdle and believe that it is strength-based, that it is for their best, in the child's best interest to receive these level of services. They're only looking at one chapter of the story, but if they turn the page and see what the future could look like because of the interventions, I think that might be very, very helpful.
Thank you both for your input. And I know that we are really going over time-wise. I would do want to pick the last two questions, and then we will put the recording online. And if any of you have other questions, you can email us, right? The next question, maybe this is can be a quick one. Do you know of any resources that allow you to seek and find out what the background of the clinician is? I'm currently in school working on my master's in school counseling and would like to have that information available to any student or family if requested. Does anybody have a resource?
So depending on where you're finding different providers, that is a question that we can put on our profile. So when, like, if you go to like Psychology Today, you can indicate your racial and ethnic background on your profile. Then there's also specific websites. I'm only informed of like Black therapy for girls, and then there's like Black therapy for men. So by going on those types of websites, you can more so look for a specific type of ethnic background in a client. I mean, excuse me, for a provider.
Thank you. And I know that to Tiffany's point, for those providers who are open about their own backgrounds, people can actually find some information from Psychology Today. So many of the providers are there. And recently I have learned that Psychology Today as a company has actually provided special search engines for specific cultural racial backgrounds. So more information are available. We are going to provide in the resources section. Okay, so I do want to come to this last question to wrap up our today. My nationality is Haitian, and I'm currently interning with NAMI of Atlantic County. Welcome. My question is, how do you engage my community on mental health when it is still such a taboo? I do want to speak to that very good question. You see on the screen here, all of us are contributing to one of the multicultural programs at NAMI, New Jersey, right? I would say that where we started would be where you could start now, is to raise your voice like you did today, and also engage in conversations with some areas, agencies like NAMI. Thank you for interning with NAMI Atlantic County. And we are hoping to join hands with our diverse communities, because that is truly NAMI. We are grassroots. We represent voices from the individual and families. And we hope that you can join us in the advocacy and the movement to contribute to making a dent to stigma, and also to pave the way for a perfect system that we can all hope for. So with that, I encourage you all, if you still have other questions, please email, like in the chat, if you can tell here, write to the webinars at namiandjo.org, and we'll try to get to your questions. And all our panelists, thank you so much for joining us and sharing with us the valuable information and your personal perspectives. And I truly feel that we have wonderful conversations. A lot of topics have been explored. But I feel that I'm sure that you all agree to it, that it is very important to not stop here. It is just the beginning, that we are trying to highlight the importance of cultural competence and humility in the therapeutic setting and in the community. And just now Mercedes mentioned the federal certified community mental health centers. Those are really truly what we hope could be the person-centered care format that serve the community as well. And so I thank you so much. As a reminder, it would be appreciated if our audience could complete the survey at the end of this webinar so that we can incorporate your feedback for future webinars. We would also like to thank our sponsor, AmeriGroup, for partnering with us so that we can have these important conversations. Thank you, Lily, Mercedes, Tiffany, Anisha, for sharing this hour with us today. And thank you to everyone who has joined us today. This concludes our webinar.
Bye.